All right, let's jump right into the biggest longevity news as we close out 2025. And we're looking at a really fascinating paradox here. It feels like just as our overall progress in lifespan is, well, hitting a wall, our ability to fight aging at the cellular level is just exploding. So, what does that actually mean? Let's break it down. Okay, so let's start with some pretty sobering news, actually. It really challenges a belief that a lot of us have held for a long time. I mean, for decades, right? It seemed like our lifespans were on this one-way trip, just straight up. But it looks like we've hit some pretty serious turbulence. So here's the headline from some brand new research in PNAS. The study is basically saying that those huge, rapid gains in life expectancy, well, they've pretty much hit a wall, especially in high-income nations. It kind of feels like all the easy wins, the low-hanging fruit, like drastically cutting infant mortality, have already been picked. And this table just lays it all out, doesn't it? If you were born in the early part of the 20th century, life expectancy was jumping by over 5 months with every single generation. But look at what happens for generations born after 1939. That rate of increase gets cut almost in half. The takeaway here is pretty stark. An average lifespan of 100 years? It's just not going to happen without some truly radical, game-changing breakthroughs. Okay, but here's where the story gets really interesting. While that big picture trend is slowing down, the story at the cellular level? Oh, it's accelerating at an absolutely incredible pace. This is where the science of aging gets super personal. We're talking right down to our DNA and the tiny little machines running around inside ourselves.
38%. Now, what's so special about this number? Well, it represents a pretty serious advantage in the longevity game. And get this, it comes from our very, very distant past. We're talking about a genetic inheritance that's been hiding in our DNA for thousands and thousands of years.
Yep, that's right. A new study on Italian centenarians found that a specific genetic lineage, we're talking from a group of hunter-gatherers who survived in Europe after the last ice age, seems to give the body a leg up in managing inflammation and repairing cellular damage. So it's not exactly a guarantee you'll live to 100, but think of it like starting life's marathon with a slightly better pair of running shoes. And while our biology might be ancient, our technology is catching up fast. Just announced. A new AI model from MIT and Recursion called Boltz-2 can predict how a potential drug might interact with a protein in just seconds. This is a huge leap forward. It means scientists can now screen millions of potential anti-aging compounds faster than we ever thought possible. Okay, so to really get the next breakthrough, we've got to talk about one of the main villains in the aging story, senescence cells. You've probably heard of them as zombie cells. And honestly, the analogy is perfect. They're basically like grumpy old tenants in your body who stop paying rent, they stop dividing, but they refuse to leave. And worse, they just hang around causing trouble for all their healthy neighbors, spewing out inflammatory signals. Well, get this. Researchers in Osaka think they've found a toggle switch for these zombie cells. It's a protein called AP2A1. And check this out. When they turned it down in old cells, the cells started to look younger, they showed signs of rejuvenation. But when they cranked it up in young cells, it actually forced them into that aged, senescent state. I mean, talk about a fundamental mechanism. This could be a massive target for therapies down the road. So all this basic science is incredible, right? But the big question is always, how does this stuff translate from the lab into the clinic, into the real world? Because a discovery in a petri dish is one thing, but making it actually work for people, that's the real test. So let's take a look at what's happening on that front. This is really cool. A major finding just came out today about a specific 12-week protocol for longevity interventions. And it turns out the order you do things in really, really matters. The logic is basically first repair, then clean, then rebuild. So you start with what they call the foundation phase, restoring the cell's energy with NAD+ boosters. Think of it like topping up the fuel tanks. Then comes the clearance phase, where you use something like rapamycin to kickstart autophagy, which is the cell's built-in cleanup crew. And only then, once the cell is energized and tidy, do you move to the elimination phase with senolytics to get rid of those zombie cells. Apparently, doing it in this order works way better than just throwing everything at the wall at once. And wow, the last 24 hours have just been a flurry of updates on therapies that target the chronic diseases of aging. For instance, Diamide Medical is getting to accelerate its phase 3 trial for a type 1 diabetes therapy, which, that could be a huge game changer.
Then, in the fight against Alzheimer's, Longeveron's cell therapy just got a massive boost by joining the Alzheimer's moonshot. And we're even seeing progress on the prevention front for chronic stuff like Lyme disease.
One of those updates really deserves a closer look. It offers a brand new clue into chronic fatigue syndrome, which is such a debilitating and frankly often misunderstood condition. For years, a lot of experts have wondered if there's a link to some kind of persistent, nagging infection. Well, now there's some real data to back that idea up. A new study found that Babesia, which is a parasite you can get from ticks, was actually found in 24%, almost a quarter, of the chronic fatigue patients they looked at. Now, does this prove it's the cause? No, not yet. But it's a huge piece of supporting evidence for the theory that these kinds of lingering infections could be playing a major role.
Okay, so it's no surprise that all these scientific advances are driving some major developments in the health industry, right? Where the science goes, the investment dollars are sure to follow. So let's take a look at the business side of longevity. $105 billion. The most important thing to grasp here isn't just the number, but the sheer scale of the investment that is pouring into this space. I mean, that is a massive vote of confidence from the market. And that's where that number comes from. A report that just dropped yesterday projects the market for cell and gene therapy is going to blow past $105 billion by 2033. This is such a clear signal that regenerative medicine isn't some niche sci-fi field anymore. This is mainstream, fueled by treatments that aren't just about managing disease, but about actually regenerating and repairing the human body. And make no mistake, this growth is absolutely global. Just this week, a company called Yuta Health launched a brand new, state-of-the-art longevity clinic in Shenzhen, China. And they're focused on really cutting-edge stuff, like iPSC technology, that's induced pluripotent stem cells. These are just incredible. You can take a regular cell, like from your skin, and reprogram it back to a stem cell state where it can become any other type of cell. It just blows the doors wide open for personalized preventative treatments. So, where does all of this leave us as we head into 2026? When you put all this news together from the last few days alone, it really points to this profound, almost strange contradiction at the very heart of our quest for a longer, healthier life. And that's the great paradox, isn't it? On one hand, we're seeing this demographic slowdown. Our progress on lifespan as a whole population seems to be hitting a ceiling. But at the exact same moment, our scientific power to get in there and tweak the fundamental processes of aging is just accelerating exponentially. So, which one of these trends is going to win out?
I think the defining question for our future is really this. Can we translate these incredible molecular breakthroughs, these genetic advantages, these AI discoveries, these toggle switches for zombie cells? Can we translate them into broad public health gains fast enough to break through those 20th century limits? The huge challenge for the next few years is going to be closing that gap between the lab and the public. That's the real story we'll be watching in 2026 and beyond. Thanks so much for tuning in.